Hello, future nurses. It's Nurse Ed Scholar here. Today we're going to embark on the exploration of the musculoskeletal assessment. You know, it's vital for any nurse, um, and uh, and in this video, we're going to kind of dissect the complexity of gathering the subjective and objective data. Um, and then what are we going to teach our clients, and I'm going to summarize it all up for you so you can use it for studying and preparing for your examinations. All right, so let's kind of unlock the secrets of evaluating the body's structural foundation. Okay, so when we kind of unravel the patient's story. We're kind of getting that through the subjective data. As diligent nurses, we need to inquire about several things. So we're going to ask about joint pain, stiffness, any redness to any of the extremities, the joints, swelling, or any of the joints warm. Does the client have any limited range of motion, muscle pain, cramps, weakness, bone pain? Have they been experiencing any limitations to the activities of daily living? Um, have the exercise patterns changed? And then you're going to kind of ask more questions. Did they ever have any joint or muscle or bone injuries? Any surgeries? Um, do they have any daily activities that can expose them? So like I guess like any occupational hazards. Does their job require them, any kind of heavy lifting, any prolonged standing or sitting? So gathering the subjective data helps guide you through the muscular skeletal kind of assessment. So when we move on to data collection, of course, we're going to inspect and palpate. So you're going to observe the client's gait. What's their posture? You're looking at their spinal curve. So when you're assessing them, what does their cervical, thoracic, and lumbar spine, what does it look like during your inspection? When you palpate the bones and the joints and the surrounding muscles, are they having any tenderness? Are they, experiencing any pain on palpation? Because, with each touch, it kind of reveals a layer of information regarding our patient's musculoskeletal health. And then we move on to the range of motion. Um, we're going to be doing active and passive range of motion exercises, looking for any kind of pain, any spastic movements, any stiffness. Is there any limited mobility, contractures, joint instability? Okay. Because remember, healthy joints move freely without any tenderness or swelling. So, we want to definitely observe for that. And then also, we're going to assess the patient's muscle tone and their strength um, by encouraging flexion and resistance. And then, you'll grade this from 0, where it's no evidence of movement, to 5, where the client has full range of motion against gravity and full resistance. Okay. Then you move on. What are we going to teach our patient when it comes to the musculoskeletal assessment? We need to empower our patients. And with that, we need to share our wisdom, especially on maintaining a balanced diet, a diet that's rich of calcium and vitamin D rich foods. to make strong bones. We're going to educate them on eating dark green leafy vegetables, unless contraindicated, dairy products, or if they're vegan, soy or almond milk. We're going to educate our clients on avoiding certain exercises that may increase the risk of muscle strain or joint stress. We're going to encourage um, healthy weight, regular exercise, because all of this is very important in our patient's musculoskeletal health. And lastly, we want to make sure that, we instill in our clients the importance of following up with the primary care provider at the first sign of any joint or muscle issues, or if there is any limitation in the range of motion or any changes in the muscle strength develop, because we want to foster a proactive approach in our patient and understanding their musculoskeletal well-being. But that really kind of sums it up. So congratulations, nurses or future nurses. Um, we've gone through and reviewed the musculoskeletal assessment. Remember that each touch and movement kind of unveils a chapter in our patient's health narrative. And as you hone in and apply these skills with precision, empathy, and commitment, you know, it contributes to the patient's holistic care. So as you continue your nursing journey, may you excel um, in the art of, the musculoskeletal assessment. So best of luck, and until next time.